Hey, it's Dr. Buck Parker, and in this video I want to talk about opioid overuse and overprescribing and addiction a little bit. Now you might say, well, why is a surgeon talking about prescribing medications or overuse or addictions? But this is actually something I have extensive experience in, because after surgery surgeons often prescribe opiate analgesics or pain medication. And a lot of our patients end up, because of their car accidents or back surgery or whatever it is, can end up being addicted to narcotics. And then I see those patients back in my clinic, and I see that what should have been maybe a couple weeks of use of these narcotics end up to be a prolonged period of time. So. And the question is, I think a lot of people are saying, well, the physicians are overprescribing these opioid analgesics at this time, and we have to cut back, which is somewhat true and somewhat not true. I think there is two things going on. One is the physician who is trying to not prescribe them, but patient gets in a car accident, breaks their back, has 12 rib fractures, or 8 rib fractures on one side and 6 on the other. It's very hard to say, no, you don't get any pain medication. So there's one, on one side, a lot of physicians are trying to prescribe them as little as possible without torturing anybody, right? Because it is one of our tools. And on the other side, we do have some, I guess we call them pill mills, where physicians are just prescribing these pain medications for extra money. So that's kind of an illegal activity, obviously, but that does happen, and that's, I think, a big portion of our problem. So there is, like, the doctors that are prescribing them, they're trying to do them ethically. It's very difficult. It's like a slippery slope kind of thing, because when your patient does have an accident or does have surgery, does need the pain medication, and they come back and they're probably addicted to that, then the patient looks at us and says, look, I have this pain and I had a surgery and I need to have this pain medication, I need another prescription. Well, in fact, the patient does have pain, which is weird about the addiction, because once they get addicted, they don't know that they're addicted. Maybe they're just a normal housewife or a car salesman or whatever, and they've never had any pain medication before. They get in an accident or have surgery, and then they take the pain medication for a little while, and then they experience the pain of the surgery and or accident, and they think, well, look, I need this. In their mind, this is from the accident, is not addiction. And so it's a very difficult topic to discuss with a patient, and difficult to say, look, I think you're addicted to this, because they get patients can be very, you get defensive, like, hey, I'm not addicted, this is from a surgery, when in fact it is starting to become addiction. So it's a very slippery slope, and I think people don't really understand that. I've seen some doctors talk about it on CNN and things like that, because because every other year a celebrity dies, and then it's due to some narcotic or drug or something like that, and the topic comes up of, like, our physicians overprescribing these things. So and recently Prince just died, and he has some narcotics on board and all this other stuff. Well, it sounds like he was probably taking them as an addictive substance, or because he was addicted to them. I don't know the story, so don't tell me, like, that's wrong or anything. I believe that's what we think at this time. So maybe that's not true. However, so the real thing is that we have a lot of patients that are addicted. Period. Okay, for whatever reason, they're addicted to opioid narcotics or opioid analgesics. And the question is, what do we do about it, and how do we bring those patients off of that medication safely and not torturing them at the same time? Because what if they did have a back surgery 6 weeks ago, and they do feel like, hey, this is the pain from the surgery. How do we move them off of that? And this is probably not really mainstream thinking at this time. But addictions, I think we're seeing more and more, and there's a great book out there, which I'll remember in a second, I'll tell you, The Power of Habit, okay? Power of Habit by Charles Duhigg talks about what a habit is, and an addiction is just a habit, like, in a very strong habit. A habit is really a trigger, a routine, and then you do that for a reward. So as you can imagine, with drug addiction, you have a trigger. So you have pain, or with some drug addiction, it may be like I see my friends that I used to do drugs with. That may be a trigger. Then the routine, which is taking the drugs, and then the reward is obviously the drugs give you a euphoria type feeling, or you feel good, basically, or you get a high, right? So trigger, routine, reward. That's the basis of habits, and that's the basis of addictions, we think, at this time. Like I said, it's not very mainstream. Not everybody agrees with that, but personally, I think that's what's going on. I see that in my patients. So if we know that, then what is the treatment? The treatment is breaking that habit, that trigger, routine, reward system. And you can either do that by not having the trigger, or changing the routine for a different routine, so you're taking something else, or you're setting up a different reward. And generally, it's the first two to program for the reward, because once you have a habit set or an addiction set, it's very difficult to break. And generally, what's going on is you're building neural pathways. Okay, so your brain is taking a sequence, and if you build this sequence and you do it all the time, it's repetitive, then it builds it stronger and stronger and stronger. And so you have to get another habit in there, another brain pathway in there, so that you can override this old strong neural pathway or brain pathway. So the question with addiction is what do we do with the people that are addicted? And I think the answer right now, although it's not, everyone doesn't agree on it, is to get these patients, first of all, they have to understand that that's the addiction and that's what's going on. They do have pain. Don't tell them they don't have pain, because they do have real pain. Their brain is sensing they have pain. But the pain is because they were addicted to their narcotic. And it's not actual physical pain from a cut, like a surgery or a broken bone anymore, but the pain is there from their central nervous system, basically. So they have to realize that that's the deal, and not a lot of people teach that either. They don't teach. I tell patients that, look, you have pain. I'm not saying you don't have pain, but it's from a different source now. It's from your central nervous system telling you that you have pain there, and it's not the actual broken bone anymore that's causing the pain. So that's a kind of a revelation for some people. And they go, oh wow, that's okay. Maybe I am addicted. Once they understand that, then you can say, look, let's get into a program, because you're gonna have to set up a different brain pathway or neural pathway now to override that old one, and that's going to take time, and it's going to take a lot of effort. And just like anything, difficult things, it takes a lot of effort to get over them. You can't just go out and earn a gajillion $1 million without doing some effort, unless you're like Anderson Cooper and just inherit everything. But anyway, most people, it takes a lot of effort to achieve some kind of reward. And so if you're going to get over that addiction, then you really need to get into a program that it recognizes you have a bad habit or an addiction, and you have to break that with your brain, your neural pathways. And there's a lot of different ways to do that right now, but I think as we kind of evolve our understanding of it, then we'll understand that it's not about changing out. Right now there's a lot of programs where you can say, well, I'm addicted to heroin. They go, great, we'll take the heroin away, we'll give you this drug that has heroin in it. It's just a pill and it takes longer. That's kind of the system right now. So I think we need to change that up and decide, look, that's not really helping people. Let's build a program or build something that changes your neural pathways or your brain pathways so that you build new, you stack something stronger on top of that old addiction or habit. So that's kind of my take on that right now. It may change, it may not change. You may not like it. You can comment below or ask me questions or tell me I'm stupid or whatever you want to do like that. Anyway, that's my thoughts on opioid addictions and over prescriptions by physicians. All right, I'll see you in the next video.